It is just a huge honor for me today to be podcast interviewing Dr. Shrey Lakhotia. He's a dentist by training, currently working in clinical informatics. He practiced as a dentist for more than 5 years and worked on an Indo-Dutch research study exploring links between periodontal problems and stroke. His clinical and research training from India's premier dental university of Delhi, which I've been at and lectured at, medical school, All India Institute of Medical Science, and most recently the Harvard T.H. School of Public Health, MPH Quantitative Methods, gives him a unique perspective at the intersection of clinical practice, research, public health, and entrepreneurship. He has presented his work at various conferences, AMIA, and spoken nationally and internationally on big data in dentistry. While at Harvard, he was awarded an Innovation Fellowship and selected for the Venture Incubation Program at the Harvard Innovation Lab. He currently serves as the deputy editor of the Harvard Public Health Review and is also involved in the development of clinical data standards at ADA Standards Committee on Dental Informatics. I mean, my God, talk about a brainiac. By the way, I want to tell you what I always tell my patients. When I went to that dental school in New Delhi and talked to the dean, he got 50,000 applicants for his class size of like 50. And I mean, my God, I've told every American that I've ever met, I said, my gosh, when somebody's gone to school in dentistry, they were in India, they were like the best of 50,000. And in America, you were like the best of 5. I mean, the competition, I mean, they got 1,200,000,000 people. And when there's 1,200,000,000 people, I mean, these dentists were telling me if they ever had made one B in their life, in math or physics or chemistry, they would just have to kiss dentistry and medicine goodbye. And I'm like, man, that would have just wiped out the whole drinking section of my dental school class, who racked up a few B's and C's on their dental journey along the way. But so how are you doing today?
Yeah, first of all, thank you so much, Dr. Farhan, for this session. And it's an honor to be here. I'm doing well, and it's an absolute pleasure to talk with you about the big data and other things about dentistry. And I'm a fan of your podcast. And yeah.
So my gosh, let's before we get into all the things that you're known for, what's the COVID situation look like? You're up in Boston. You're up in the Northeast. I'm clear on the other side of the country, down in the Southwest Arizona. What does COVID look like right now in Boston? And more importantly, do you see light at the end of the tunnel now that there's 2 vaccines that are about to get FDA approval, and some of them are saying that they may start shipping the vaccine this month, like December 21st. So my question to a brainiac like you, are you going to take the vaccine?
Yeah, that's a great question. I would probably wait for the results. The results are out, but I would like do some research, and yeah, I will be willing to take it because I have to take being in person, going to the hospital in person. So that would be, I think that's fine. But coming for Boston, it's right now things are kind of almost normal, but almost normal in the sense that people are going out, we are doing shopping, other things, except for other events. Large scale gatherings are not happening, obviously, but wearing masks. But coming for talking about the vaccine, like how much it can be implemented, I think the real task is going to be for execution of this vaccines. Like how many people are going to be willing to take the vaccine? Because I suspect that not everybody is going to be willing, because not everybody, I think, believes in vaccine. Like there are a lot of people who are not believing in vaccines, and then a vaccine coming so fast, which is, I think, a great effort. So I think a lot of people will be skeptic, will be having some, will not be very comfortable.
I've lectured in 50 countries around the world, and I've only found one thing that everybody believes in. And there's like 1,100 different religions. There's 208 different countries. There's all kinds of different politics, religion, art. But the only thing they all believe in is the U.S. dollar. After the U.S. dollar, vaccines and art and all that kind of stuff, it starts going crazy. So it'll be interesting to see. I called you to be on the show. You didn't call me, and I wanted you to come on the show because I've seen and heard of some of your lectures. You were a guest speaker at the Texas Gulf Association for Healthcare Quality, and when you talk about explaining the diverse healthcare professionals on building medical data repositories and data sharing, it's been a pet peeve of mine because on something that's very simple, like how long does a filling last? And let's just compare the tooth color to the amalgam. I mean, you can't even get a straight answer. And I'm sitting here thinking, okay, there's dental insurance companies like Delta, Blue Cross and Blue Shield, United. They're probably sitting on hundreds of millions of claims. And I would think the answer is inside that data, but then when I talk to people, it's kind of like at 2020, dentistry doesn't mine their own data. They've been collecting data electronically for since I got out of school. That was 30 years ago, and it's like, well, aren't all these answers knowable? I mean, couldn't an algorithm answer these questions? And when you talk about big data, when you say big data, is that interchangeable with artificial intelligence and machine learning and big data? Is that all three synonyms of the same word?
Machine learning is different. I mean, big data is typically, I would say, more related with the machine learning. So machine learning is a subset of artificial intelligence. So machine learning is typically with large amounts of data. When it's like a subset of the AI, the whole AI domain. So they're not synonymous.
And how much of does the insurance claims, does that pique your interest? I mean, would you like to be able to mine all the insurance claims to see if you can connect the dots between different variables?
Yeah, that's really interesting. And what I see is that, for example, when a patient visits a dentist, so not every information is recorded. And that's because majority of the information in an EHR or in a patient record is actually in the dentist notes, the notes. And that is the unstructured information, which is not categorized structurally, where you can have some AI models. Like nowadays, we have so many AI companies doing something in dentistry. But the notes section of the EHR is the section which is unstructured, and that contains the majority of information. And that typically also has information like, what happened, like, the filling came out, or what, those specific things which are not regularly captured in the structured information in EHR.
But you could access their electronic charts. I mean, if the dentist let you, right?
Yeah, I mean, you're talking about a patient, if they can access their chart?
Well, I mean, for research purposes, I mean, like say a big operation like Heartland Dental has 1,000 offices. Pacific and Aspen have over 800. If a company like that gave you permission, could you enter all the electronic chart and the insurance chart and all that kind of stuff to? Because dentistry is not standardized. I always the thing that I still have not fully emotionally recovered from was my gosh, I got out of school in 87, and then 10 years later, probably you weren't even born yet. It was 1997. Were you even born in 1997?
I was born in 87, so it's good to see it. I was born
in 87? Okay, that was the year I graduated from dental school. So 10 years after I graduated from dental school, the most popular magazine that every mom had on their nightstand was Reader's Digest. And a Pulitzer Prize-winning writer, William Eckenberg, wrote this infamous article, February 1997, How Dentists Rip Us Off. And what he meant by that was what everyone knew. He took study models and x-rays and went to 30 different dentists. Now, this is a guy who got the Pulitzer Prize for his work on writing up 3 Mile Island. He's the most esteemed journalist. He went to 30 different dentists, including the dean of the University of Kentucky, and he got 30 different treatment plans. And it's like, okay, well, I mean, if you took a math problem to 30 mathematicians, they wouldn't give you 30 different answers. I mean, so how? I mean, it just made dentists look crazy. And then years later, someone at the National Institute of Health said, "What's going on here?" So they redid the study, but went to 100. And they had two treatment plans that were the same because two guys said you need nothing. So they had 2-0, no treatment, no money. But treatment plan number 3 to 100 were all different. And so my question is, I mean, that's just crazy. I mean, who would ever, I'm like, I wouldn't commit to having a surgery if you said, oh, you got to have a surgery. If I went to 30 different surgeons, they'd all tell me something different. So I was wondering, do you think big data, machine learning, and artificial intelligence can maybe standardize the treatment plan more than it is currently now, where everybody has a different opinion?
Absolutely, absolutely. This is such a big problem. You are spot on this standardization of treatment plans. And to be honest, it's also dependent on the type of care where you are going. Like, for example, an academic institution-based setting will have a different, they will be kind of having different approach. Like, it may not be that intensive, it may not be that aggressive treatment. But if you go to a private practice, they might be aggressive. And if you go to some like a community center, it might be different. So those are also the places where the kind of approach is generally different. And yes, within those different levels, there is an individual variability. That is, one dentist probably prefers something, other dentist probably prefers something, and so that is something which that is something where AI can really help, because when you have so many treatments being done, then we can actually see the outcome, that what is the patient actually experiencing, and then give the patient the best recommendation.
And then there's other things that like when you talk about aggressive treatment plans or less aggressive, I can see private practice maybe have more aggressive big ticket plans, implants and things like that. But when it just gets back to a little kid, when I look at the insurance data, there's 32 teeth. There's just 4 huge spikes for the 4 6-year molars. And that's a tooth most likely to have a filling, a crown, a root canal extracted, replaced by an implant. It's just, the tooth is just doomed for failure. And then I see dentists doing this little wimpy little plastic sealant where they're acid etching pits and fissures filled with cookies and crackers and biscuits and putting this little plastic, and their own research says in 1 year half of them fall off. And I'm thinking, my God, that needs to be so aggressive that every 6-year-old that should be those fissures should be removed and placed with like an occlusal amalgam or a composite, something really aggressive, because that tooth has not very good odds of anything. And it's like they're wimpy on that. They're still doing sealants. And I'm like, well, why are you doing a sealant on a tooth most likely to have a root canal or get extracted or replaced by an implant? So they're not aggressive when they need to be aggressive. And then it just seems like there's just a long way to go before dentistry becomes more scientific and less artistic, in my opinion. And dentists always say, well, in my hands, this works. And I'm like, well, I don't care about your hands. I want to see what happens when 100 million people do this. What does it look like 10, 20, 30 years later?
That's absolutely right. It is, dentistry is actually more artistic. That's what I was taught when I was in dental school, that dentistry is all about art and science. But I do believe, with the knowledge like I gained at Harvard and other places within the Harvard MIT ecosystem, that big data AI is the thing which will change dentistry as well, along with other clinical domains. And yes, it's like each dentist having their different preferred ways of treating a tooth, like as you said, about not being aggressive at the start. Then at the start or something, when we really require an aggressive treatment. So those are the things which really exist, and AI can really help in that by standardizing or recommending the dentist that, okay, this is what the patient needs to be to undergo, based on the huge amount of data. So we need huge amount of data for that.
So you lecture a lot about creating a culture of safety. What does big data and artificial intelligence in your work have to do with a culture of safety?
Yeah, so I was actually talking more about the safety in data transmission, like when we are sharing data. So and yeah, and if we also see about safety, that's I mean, there are two aspects. One is, within when you're sharing data across organizations within different ecosystems, then in the US, we have this HIPAA law where we need to have the patient data protected, and it needs to be kind of really, you know, protected so that the patient personal identifiers are not leaked. And so that requires a lot of effort, and that's another metric. And another thing, the other things which we can actually help in safety, like in quality improvement plans, like a lot of organizations have their quality improvement teams. So big data can help in that um, by like by using by setting measures, like which measure is the more important one based on similar organizations in other places in the US. So that will help in benchmarking and help in showing them that where they stand, any organization. So it also helps. It is really useful in quality improvement plans and performance improvement plans within other organizations, healthcare organizations.
You got an award at Harvard University for your work on artificial intelligence in dentistry. I'm looking at a picture right now that says facilitated with the Award of Honor. Why did you get an Award of Honor?
Yeah, that was not for AI in dentistry. I think that's the innovation thing, the innovation award. So that was, where we were supposed to develop a business plan to solve an unmet healthcare need. And that was so that is something where I targeted a different problem, not dental problem, but a different problem that was for respiratory patients, completely different from dentistry. But that eventually I transformed it into a venture, like, in a venture in the sense that trying to build a venture out of it in the Harvard Innovation Program, Innovation Lab. So yeah, that was the award, which was basically for people who have done some research into commercializing a healthcare need and how you will execute and deliver on it. So that was a
I,
great experience.
I mean, I look at you and I look at what you've done, and you're kind of a dentist at the intersection of data science, healthcare, and innovation. Where does that even come from? Were your parents entrepreneurs? I mean, a lot of dentists are, you think of a quiet, shy introvert in the library studying geometry, and here you are at the intersection of data science, healthcare, innovation. What do you think happened in your journey of life that made you interested in all those? I mean, how did you get interested in dentistry, data science, and be an entrepreneur?
Yeah, thank you so much. That's a great question. I mean, I was a dentist, and my dad is an eye surgeon. So I guess I wanted to be a dentist because seeing other healthcare people in home kind of made me motivated. And but I think the entrepreneurial bug is something which was there since early days. Like when I was in data school, I tried to build an e-commerce website for different areas, like for medicines and for other eye care, etc. But it kind of didn't work. But still, I tried my best. I mean, I did do some a lot of research and all that. But it's more fun. It came out here when I took a lot of classes here at Harvard. So I will give full credits to the Harvard MIT ecosystem. It has unleashed, and all innovation and entrepreneurial things inside me have kind of got unleashed by this ecosystem. So I would say that's something which has unleashed it.
So, did your dad ever forgive you for not being an eye doctor and going into teeth instead?
Yeah, that's. That was definitely a discussion there when I got into dental school. But I think that was yeah, that used to be a talking point. But he's fine. I guess that's fine, normal.
You know, it's funny how when you grow up, you have all these impressions of other countries, and my four boys, they still say to this day that they learn more following their dad to 50 other countries, and they said they learned so much more being on the road. And you were born in Calcutta, India, where, like say, my oldest sister's a nun, and that's all she ever talked about was Mother Teresa of Calcutta. In fact, I went and saw where she was born. I saw her, all of her works and all that. But I was told by Catholic nuns from kindergarten to the end of Creighton that India, they're all vegans. They have the best diet in the world. They just eat so healthy. And then I went over there. Every dentist house I went into, I was greeted with a big plate of sugar cookies. And I was sitting in India thinking, my God, I thought these people were the healthiest eaters on earth, and they eat as much or more sugar than anybody I've ever seen. And so when you're looking at big data and you're looking at all this AI, how much of the problem in dentistry is still eating sugar and diet versus do you think the big breakthroughs are going to be changing their diet, or do you think it's going to be microbiology, or is it going to be dental materials, or what do you think is the where AI and big data is going to help reduce this needs? Because as a dentist, it's still kind of embarrassing as a dentist to be a dentist for 30 years. And when I started, dental decay was the number one disease, chronic disease that humans have. And oral cancer is the only cancer that in my 30 years they haven't moved. I mean, it still has the worst 5-year survival rate, one of the worst. But it's kind of like when I started dentistry, it was the number one chronic disease, and oral cancer was not good at all. And it looks like nothing's really changed in 3 decades of drilling and filling and billing. It seems like dentistry's kind of stuck where they're at. And do you think that's because of diet, or do you think it's microbiology, or do you think they need a vaccine? You know, we got a vaccine for coronavirus. Do you think we need a vaccine for Streptococcus mutans or Pigeoncellis, or what motivates you to think in the future where we could start moving this needle and maybe become the number 2 disease or 3 or any of that stuff?
Yeah, I think that's a real problem. And to be honest, I think the problem is different in different geographical regions. So like India, like as you said, sugar eating. The thing is, for like just giving context for India, it's not just sugar eating for dental problems. Dentistry is not that important compared to like other medical areas in India. So in India, like, dentists are not, people don't take dental care seriously. So and that's a very geographically specific for India. But coming to the US, what I see is like and generally everywhere, like US and everywhere, like we are having the same problem of dental decay, which is still there prevalent everywhere. And like oral cancers are more in India. That's because of those tobacco kind active, they eat tobacco and other things. But if you look at the broader picture, like caries and other problems, root canals happening, I would say, I think personally that we would probably have something like stem cell or some stem cell therapy coming in, or something like biologics coming in. But big data is more going to be for the dentist-patient relationship. So it's going to be more for getting better treatments at the point of care and having a better prognosis, not just diagnosis, but also prognosis. Like we can tell the patient that, okay, our AI model is telling that if you continue with the current regime, then you are going to have this and this problem. So, or this treatment is going to be that much efficacious. So I think it's going to be more of prognosis. So I think personally, I think stem cells or some kind of biology, things would be there, which will be really shaping up dentistry. But otherwise, I think in general, I think AI is definitely going to be changing the dental-patient relationship.
I keep reading many articles of in the United States of physicians massively complaining about how much paperwork they have and entering all this data. And I know my physician friends in my backyard, they just they hate all the paperwork. You just see that. Are we close to? I mean, I can do voice activated searches on my iPhone. I don't get out my big fat thumbs and try to type it. I just say, what's the Bears season record, and it tells me. Do you think we're getting close to where the dentist will be mic'd up, and all these electronic records will just be translated, and we don't have to sit there on the typewriter all day typing in notes?
Yeah, I do think that's something which will be there. That's going to be so useful for dentists, like looking into the dentist's day. Like they take patient note, they have to remember, recall the interaction and write down the notes. I mean, verify it student and all that. So something like this, which can transcribe it live, would be really useful. But I think I think we already have a lot of these things in other medical areas, like note-taking startups coming up here, which help the people help the physicians in transcribing notes for the visits, and especially with virtual health. Now this is kind of getting more interesting, because now uh, the setup, the laptop or the computer anyways has the software, and we can just have it transcribed. But yeah, I do see something like that would be really useful and would come up. I'm sure there may be some startup born. I'm sure.
When you are studying artificial intelligence, what do you think is the least understood? I mean, I know when I bring it up in like with my own family, the first thing they talk about is that Elon Musk is right, and we're going to give these machines a brain, and they're going to turn around and kill us all, and they're robots and they don't need oxygen and blah 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 blah. I mean, it seems like when you say artificial intelligence, a good portion of the United States already has a negative reaction. They think they're going to be enslaved by these things, and there's all kinds of movies. But when Elon Musk says it, what do you think is the when you're in dentistry and you're talking about artificial intelligence? Where do you think it's most not understood or misunderstood, or they don't understand? They don't see it the same way you see it. Where do you think that is?
Yeah, that's a great question. I mean, AI is such an abused word everywhere. Like everybody uses AI. In fact, I know a lot of professors who have started using the word software instead of AI because it's so much used. So, so I think part of the reason is because we have so many people coming and having some AI solution, which is great. I mean, some of them may be great, but we have so many things coming up that makes it like, we tend to then generalize that, okay, AI, okay, we know it will not be useful. So what we would probably need is something more research backed, and with a more transparent way, in a more transparent way. So like, for example, if we go to a dentist and say we have some AI thing to help them, so they will definitely not believe, or they will be skeptical, which makes sense because uh, first of all, what's the validity? Like, what is the like, is this research based, or is this something which I've done on my own, or anybody has done on their own? And then the second more important thing is that they have a big downside. If, for example, the AI model is not doing its best, is probably giving a wrong diagnosis, then there is a bigger the risk reward ratio is not favorable. The risk is higher and the reward is less. So that's a big downside, because in healthcare we need to have really refined AI models, because AI models are not permanent. What works right now may not work after a few months. They differ with geography and time, and what works here in Boston may not work even in Arizona. Not thinking about US and India, that will be obviously very different. But even, I mean, what I mean to say is that even within organizations, an AI model which works within an organization, it will not produce the same results in another location. So that is why we have a lot of AI is not, people are really still averse to it, because it's not easily translatable. And uh, and I would say that it also needs to be more open and transparent when people are doing some AI research or any startup being more transparent about where the statistics are and how they are validating it. I mean, I understand from the startup's point of view that it may not be, they may not be really um, interested in, sharing more details, but I mean, that's the trade-off. So I think that's really needed. Getting more, being more transparent about the research, how it is validated, and then also, uh, being highly performing across different geography and time.
Well, I think a lot of dentists use AI a lot and they don't need it. Like when they're on Netflix, AI is trying to predict what you'll like. I notice whenever I open up YouTube, the first 3 pages are all NFL football games. I mean, so they definitely know. I think they figured out I'm an Arizona Cardinals fan, and so I think a lot of people are using more AI than they realize. Where do you think dentists are using AI without even knowing it?
Yeah, I mean that's right. It's AI is such a it's part of our lives now, and without us realizing. I think dentists right now are probably using it when they are dealing with maybe insurance providers. I'm sure the insurance providers must be having something with having so much huge amounts of data. So they may not be using themselves directly, but maybe indirectly. And then we have this DSOs, the concept of dental service organizations, who deal with so many data. So I'm sure at the back end they must be having something to deal with that information, and even any kind of simple automation would be, or even a simple thing like say like filing claims or something like that, which they do at the back end. So I'm sure that must be having, the dentist might be using AI indirectly in that way. But
Fareed Zakari on CNN wrote an amazing book, and or maybe it was he's written several articles on it too. But he was showing how that most of the socialized national medicine programs started after World War II, about 1950, and now it's 2020. So there's like 70 years of data on those. And America never really had a system. It was kind of real more entrepreneurship, except for Medicare, which is health care at a federal level for over 65, and then the individual states Medicaid for the poor people, and it's a different plan for each state. But when Taiwan went to set up, and Singapore, when those two countries went to set up their plan, which was 50 years later, they had 50 years of data to look at. And through just looking at all that big data for half a century, they set up a healthcare system that the only place you'll find that outcome in the United States is at your top hospitals like Mayo Clinic and the Cleveland and Beth Israel, Deacon Owens Medical Center, all that stuff. But it really shows that when if 100 different people had a cancer in America and they went to 100 different town doctors, there would be this huge distribution of who got the right diagnosis, who read the x-ray right, who did the right treatment, who's up on their protocol. I mean, I might have got an old doctor who graduated 50 years ago and hasn't been to a CE course in 10 years. Even the thing that blows my mind the most is for Medicare, if you are a cardiovascular surgeon, you have to report your 24-hour mortality rate. And there's like 5,000 cardiovascular surgeons, and dying at 24 hours varies between 1 and 11%. I mean, I don't want to go to the guy who has 11% of his patients die, but it just seems like there's so much room for improvement if you could just get all these dentists to just be able to see the same page like Taiwan and Singapore do.
yeah, that's right. That's it's I mean, I think that again, that's something which a big data would be really helpful, and where we can have different organizations look into a common data set and see what things are missed. We can have validation by other clinicians to see if there is something which was missed or something which was wrong. And yeah, that's a very bad problem. I think for dentistry, what I mean, I do know that there's a lot of research which is supported by NIH for different such kind of you know practices. I mean, such improvements in dental care, like for research. But I would say something like that, where we have a repository of the data, and we can validate what the treatment was given and whether it was required or not, and things like that. So that would be really helpful in dentistry. And but one of the roadblocks in actually sharing data is that it kind of gets really difficult to get data, but that's the biggest thing, because it's really difficult to get data.
I know it really it even little things like take an obituary. I mean, they almost never even say how the person died, and a lot of Americans will say, "Well, that's private." Okay, it's private, but he was on public Medicare when he was fighting this disease, and so you want all my money for health care, but I want all your data so that my grandkids don't make the same mistake. You know what I mean? And so instead of opinions, it'd be nice. They're even talking about AI powered caries detection. Do you? It just seems so obvious that in dentistry, one of the greatest ways to increase your quality is to increase the magnification. I mean, when you wear loupes, you see better. When you have a microscope for endodontists and can see in the canals. What I love about the CBCT is, you got this big computer, even CAD CAM. The first time I ever prepped a tooth to do an onlay, and I had my CEREC machine, this is, gazillion years ago, and I scanned it, and I looked at my prep on a computer monitor. I thought Stevie Wonder did the prep. I thought, what blind dentist, cut this? I mean, just seeing your prep 40 times larger. And so to me, I don't think humans would have a chance at who would be better at reading a mammogram, a computer machine or Howard with 58-year-old eyeballs looking through, lenses. Do you think, how close are we before AI reads my dental x-rays and doesn't even, and can do it just better, faster, easier, probably do it instantly? How far are we away from that?
Yeah, I think that's a typical question of AI replacing humans. And I think in healthcare, I think AI will, I don't think it will replace, and I think it should not replace also. Being healthcare is so important because any margin of error has a lot of huge repercussions. So what I think in the future would be is that AI assisted technologies, like AI will do a screen for you, and then you will just screen and say that, okay, yeah, that's fine. So that means that if you are taking 30 minutes or 20 minutes to see something or to check if it is fine, then you might be checking for or seeing it for 5 minutes.
But it's really weird because Dental Towns, it's been out since 1999, and now it's 2020, and I cannot tell you how many times someone will post an x-ray and say, well, that's a cavity. And the next guy like, no, it's not. It's a Watts. And the next guy goes, well, I would check it in 6 months. And I'm sitting here thinking, my God, here's 10 people that are all doctors looking at the exact same image on an x-ray, and they don't agree. In fact, one of the biggest sources of stress in small community areas is you come to me as a patient and I say you have 4 cavities on these 4 teeth. And then the patient goes and gets a second opinion across the street and he says, I don't see any cavities. And trust me, I know of several incidences where it almost landed to blows, where the dentist after work went across there and said, what are you out of your mind? And they sat there. I experienced that here in Phoenix, where 2 of my very good friends, I thought they were going to kill each other because one didn't think they were cavities that needed replaced and thought they were watches, and the other one thought, oh my gosh, these should have been done 6 months ago. So it's just like I say, there just doesn't seem to be any standards in something as simple as diagnosing bite wings for cavities. I couldn't even imagine if it was a cancer and a mammogram or something like that.
That's a great thing. That's not a great thing. That's a great problem for an AI model. So that's, unfortunately, this is a highly prevalent thing which is there in dentistry, where what it's subjective to what the dentist thinks. So it's not objective. It's not clear. It's more subjective. So one dentist might think, okay, this is diagnose it differently, and the other dentist will diagnose it differently. So I think what is needed, or what will probably be really helpful in dentistry, is having a benchmark, like a standard of, say, for example, for X-rays, that, like, say, if this much is the radiolucency in the dental caries for these teeth, say for any kind of teeth, then that means that this is caries. So something like that. Obviously, I'm talking it in a very easy or in a very simple way, but it can be like complicated, having like, okay, if the X-ray is shot on this particular machine having this parameters, then this much should be the unit, and that is how we will classify into this type of caries and the other type of caries. So and do know we do already have such things, but I think it's not, it's difficult to implement it in the real world, because nobody will have the time to see and measure it. Like a dentist will not see that, oh, this is this much percentage radiolucency, or this much whatever the parameter is, so this is not required for this, because they don't have that much time to see that. And that is where the AI will be really helpful. So the machine can automatically do this and say that, okay, this is this type of caries and this requires this treatment based on whatever the set parameters or the set standards are.
I love that quote. There is a principle which is a bar against all information, which is proof against all arguments, and which cannot fail to keep man in everlasting ignorance. That principle is contempt prior to investigation, by Herbert Spencer. And it's so true. If you just say a word to anyone, they already have an emotional response to that word. Like just say, anything, say religion or global warming or AI. I mean, you say AI, and there's already a bunch of people who think that you're going to have me, killed by robots, it's just amazing how the human mind has already made up its mind prior to investigating something new, and this is all new. And I was wondering, what's new? What do you think the next big thing in dentistry is? What do you think is the next big thing in dentistry?
I think the next big thing in dentistry is, I think going forward we would see more of AI-based solutions coming up for the clinicians, the dentists to use, because dentistry is so much dependent on X-rays, which is like a very classical case for using computer vision, those types of machine learning. So we would see more of that, and I think we are also seeing a lot of interest from dentists. So when I was at the Harvard Innovation Lab, I know a few dentists who were asking me that they have some idea in dentistry and they want to build a startup. So yeah, and they did work on it, and but obviously they needed a data scientist, because they were looking for that, and so I think what we are going to see more moving forward is that more dental professionals embracing AI. The young people, like the young dentists, the budding dentists, they are more interested in technology. They are more like, because kids these days are just born with mobile phones and technology. So they are like more conducive to using such kind of things and trying out these things. So, and I do see a lot of dentists, interested in AI, in applying it in dentistry. So we are going to see a new generation of new dentists using some AI, and some of them may build startups, some of them may go into research, but more of this, I see that. I mean, in general. So
Yeah, and when if a lot of kids like you didn't follow your dad into eye doctor, but you became a tooth doctor. You went from ophthalmology to dentistry. A lot of kids right now, I have 6 grandkids. I keep telling them, my gosh, 100 years ago, you wouldn't want to be the guy who couldn't read or write. And nowadays, I don't think you want to be the guy who can't do a computer language. So if you had grandkids, and I got 6 of them, and one of them's now a teenager. He's 13. He just crossed into the teens, and you wanted him to, follow this journey. Where would you start him out in programming? Is it just would you say Python, or would you start him out at HTML or C++? There's all these languages. What's the road? What's the best road for kids to end up where you are?
Wow, yeah, I would say first of all, starting with the most basic and simple thing, and that is a simple CSV file or a simple CSV file, so like comma separated data. I mean, that's the most simple, but I think that's one of the more, it's like one of the ways to see data, how it is structured. Like, and I mean, it's not a programming language, but it's just like trying to get familiar. But otherwise, after like coming to any programming language, so I would say something, I would say Python is obviously a very an upcoming thing, and that's being used by a lot of data scientists, and it's getting more popular because it can do not just data analysis; it's more for programming. So yeah, that's something which I think will be.
Another huge now. See, I don't know how to program. 2 of my 4 boys are doing it and loving it, and I'm trying to get all my grandchildren to. When my boys were little, when we were little, Mom made us take piano lessons. So me and my 5 sisters all do piano lessons, and she had all these things that we had to do. And when my kids were little, I thought, well, I doubt they're going to be a great piano player. So instead of piano player, I got him a computer. I got him a computer lesson. So I found this kid, and they loved him. And he came over once a week for 1 hour with each one of the 4 kids, and really, really taught him a lot. And I think it's great. But I don't know enough about programming to know, like, when you're looking at artificial intelligence, some people say it's mostly object and image related. But another huge problem is the dentist is selling a filling, and he's signed up for 12 different prices. Insurances are paying him 100, 110, 120. I mean, anywhere from 100 to 250 for a filling. And he's providing this filling in a dental office in an operatory for an hour, and he can't even tell me how much that cost. I'm like, well, how much does it cost to do a filling in your dental office for an hour? I mean, to me, if you're open 32 hours a week and you've had steady numbers for the last couple of years, the same number of square feet, operatories, the same number of staff, hygienists, assistants. I mean, you would just take your total cost divided by the number of operatory hours you're open, just to give you a blank cost. Like, does this operatory cost you 100 an hour or 200 an hour? And furthermore, if you're signed up with insurance plans that pay you between $100 and $200 for the same filling, I mean, my God, at $200, if you had 50% overhead, you'd make money, but at $100, you just did it for free. I mean, the bottom line is, when I'm in a hospital, I usually have to go to the hospital every 10 years for a kidney stone. And, I've done it 3 times in my life. And it's amazing when I'm in the hospital, nobody in there can tell me, what does this hospital collect today? What is the break-even point for this hospital? What is your labor cost for this? I mean, so the business of healthcare, I mean, my gosh, you just can't find anybody that really knows their numbers, except for some of these large DSOs where they can have a whole department watch numbers. But do you think AI is more object oriented, or do you think it can just do a lot of crunching the numbers and accounting, tying your schedule to your accounting software? Do you think you'll see it more as a business application coming soon?
Yeah, I'm sure that this is something which I'm sure like a lot of DSOs might already be doing something like using AI to help them in their automation or in their number crunching for the dentist. But I think it's how it works. Like for AI, it's like dentistry for a clinician. It's what they do is you take a lot of X-ray. That's definitely image. But the other things which the DSO like does is the data. So that's the raw data. I mean, that's not an image, obviously. So both are different kinds of data which are which can be used by AI. So there is nothing which is like AI can't do. It just needs to be structured data. That is everything structured, because otherwise if you say have notes, for example, even though patient notes, so that is the best example of unstructured data. So that is something where that is also something where AI can actually do something. And we have natural language processing. So what it does is that based on that sentence, it tries to extract the concepts that what is the person trying to convey, or what does it mean. So one clinical concepts based from similar words used. So that things like that. So what I mean to say is that AI is not limited by any kind of data. I mean, it will be great. Ultimately, what all AI do, they need is having data which is structured and formatted in a way so that we can have some AI models getting developed, which can help in predicting and also in automating a lot of tasks. But otherwise, I think even if it is unstructured, we do have now AI helping us in that. So everywhere, I would say.
So what are you most excited about now? What's got you what do you dream about late at night when you're thinking about this? What's got you most excited?
Yeah, it's such an exciting session. I think it was great. I think there are a lot of great ideas which we bounced off. I mean, I also got to know while talking. I mean, just reaffirming myself. So I would be thinking more about connecting with different dental softwares. So that's a big challenge. One of the other things. Now that's not in big data. That's software engineering. But typically, when you want to do something in AI and make it really in the clinical space, so we do need to get data from people. So the big challenge is how do you get data, and that is where a software engineer comes up. So I would be more thinking about how we can have something. I would be more thinking about like these new APIs for different software platforms, which which helps in transmitting data securely. But that's something which I'm kind of getting more curious these days about.
So I noticed they launched a new dental AI council. Did you see that? They launched it. What is it? Dentalaycouncil.org, and that's a dental AI council. There, it's kind of like a dental association for dental AI. And I was wondering if you're aware of that, and if you think that's a good idea. Or I noticed that when I looked at the members, it seems like it's mostly dental insurance companies like Delta Dental, Henry Schein selling supplies. So it's like and dental laboratories, and what else do we have? And all the big DSOs, Cigna, Heartland, Walmart, um, Smile Brands. So it's basically labs, DSOs, dental supply companies. What do you think they're trying to get the most out of this? Where do you think that council is trying to get information? I mean, to solve what types of problems? I mean, you got insurance companies, dental labs, dental suppliers, and big DSOs.
Hmm. Yeah, I did hear about the AI Dental Council, and I think it's a great initiative. But I think what is needed more is a more broader level of participation. Like it does have like the DSOs and the Henry Schein, which is the leader in the dental you know market, in the dental products market, and even the EHR systems. So I would say like something more like having a more people involved from the academic background. So that is something which I probably think it's like it may be really beneficial to have. in that. And I think it's I mean, these councils are great, and this is a great platform where people can come and discuss, which are who are having same interests, similar interests, and so I think it's a great platform, and I think it would be really beneficial to have other areas also, like other academic groups, and yeah, and I would say that everyone should have a disclosure also, that even if some researcher or somebody is coming, that okay, a disclosure that okay, they are working on this in this startup, because these days AI also means a lot of people are working on startups. So just so that I think that's what would be really helpful.
Um, you when you look at the Harvard T.H. Chan School of Public Health, when I look at all the specialties, I mean, dentistry has it had 9 specialties when I got out of school, and now it has 12. And I look at all these specialties, and public health is the most important, but it doesn't get near the attention as oral surgery, orthodontics, all things like that. And you're sitting there at the Harvard T.H. Chan School of Public Health. What do you think dentists don't think about enough about public health versus orthodontics and oral surgery and endodontics and what have you?
Yeah, I think that's a lot is dependent on also the dentist who's getting graduated, like the young dentists. So typically, I think they have a lot of loans, and a clinical specialty is the one which is really highly paying. And I think, I mean, just being bluntly put, I think it's also the financial incentive of being, in a clinical specialty, which kind of really helps to take up the burden, because the dentist also has to pay off their loans, so which is right, which is understandable. So that also makes it a bit, difficult to get more interest in the dental public health specialty. And I would say, secondly, probably public health in general has not been very, like very in it has not been in the limelight, so it has not been that important, or not like, how to say, like, I think it's not considered, it's not I mean, it is considered, but it's not given much importance as it should be, I think. I mean, I think we can have more importance given to it. I mean, having more public health focus. But I'm sure that the coronavirus pandemic is going to change it. So now we are going to have more interest in public health and even dental public health, like the specialty of dental public health. Even though we don't have anything right now, like coronavirus, doing something specific for teeth, but I think still in general, the public health boost will help the dental public health specialty to gain more significance, because now we know how much public health can, be important, or uh, be really involved in our day-to-day lives.
So of the 12 dental specialties, you got oral surgery, endo, perio, pediatric, ortho, prosthodontist, dental anesthesiology, oral facial pain, oral med, oral path, oral radiology, dental public health. Which one do you think will be most affected and changed by AI over the next decade or so?
Hmm. Yeah, I think that's a great question. I would think the oral
Oral
medicine.
medicine?
Yeah, because I think that's the. I mean, I believe in all the platforms, but I think the oral medicine special. I mean, if you talk about just what specialties, I think the oral medicine is going to be changed. Is going to be changing a lot, because that's specifically dealing with diagnosis, and I mean, that's more for diagnosis, and like, for like whenever a patient comes up, a new patient comes up, like in academic settings, I think the oral medicine department is like more involved in taking history and making diagnosing what the patient is having, and understanding their the patient's concerns and all that. So I think the oral medicine seems better, but in general, I don't. I think all the specialties are kind of more. at the same level. But I think oral medicine and then endodontics.
And endodontics.
Yeah.
And why endo?
Yeah, I think because endo is like one of the most common, things, and the more what we are seeing right now is that AI is coming more into dental caries and our root canal treatments. That's like one of the most common procedures which any dental patient goes to, like a tooth problem, like a tooth sensitivity, hot and cold sensation. So that's why, and I think that's why an AI helping them just getting more caries. Like there are so many startups I know even in Boston doing similar things. So I think that's going to be really that's one of the in the immediate future. I think that those two specialties are going to be really impacted by AI.
I always have been committed to trying to get more exposure to public health. When I opened up my dental office in '87, we started the Arizona Citizens for Better Dental Health, and in '89 we got the Phoenix water supply fluoridated with community water fluoridation for 20 years, and then when it expired, we got it passed again. But when I look at like the departments at the Harvard School of Public Health, I mean, dentists don't even, they don't even think about this enough. They're always thinking about implants and Invisalign, and the departments are biostatistics, environmental health, epidemiology, global health and population, health policy and management, immunology and infectious diseases, molecular metabolism, nutrition, social and behavioral sciences. I mean, it's just so much to go. And it's just so amazing. I can't believe our hour is already up and we already went over an hour. But I wanted to ask you, do you think, dentistry and medicine separated? I mean, the first dental school was in Ohio, and then the first dental university was in Baltimore. And, the legend has it that, the physicians needed a bed where you lay down in a hospital, and dentists needed a chair that's set up. But anyway, they went two different paths. Do you think that was kind of a bad idea, and that over the next century those paths should come back together? Do you think what do you think of that separation, and will AI help tie it together, or what do you think of that diversion?
Yeah, I think that's that's the hottest topic right now. I think because dentistry and medicine have been really separated, and we are seeing more and more connection between oral problems and systemic problems. So I think it's obviously going to be more coming together, because now we are going into breaking down all the silos of data. This is a separation which has been going on for a lot of time. Like I think so. So that's what I think. That was obviously not a good idea. It may be convenient at that time, but I think right now, having a more dental and a medical integration will be really helpful and will give more insights. So
Well, it has been an absolute honor to podcast interview you. Was there anything that you wanted to talk about that I didn't ask about?
yeah, thank you so much, Dr. Farhan. It was amazing to talk with you, and thank you so much for for taking your time and having me on your show. It's an honor for me. And yeah, I think all the topics were great.
Well, the reason I'm really excited about your work is because I've watched humans with natural intelligence for 58 years, so I'm really excited about artificial intelligence, because it doesn't seem like it has to be that much better and it would beat natural intelligence. I just think there's so much opportunity. Even like when I can't believe, like, simple things like when I use a bonding agent. I mean, if a new bonding agent came out, but every time a dentist used it, it was scanned and it was in the notes. Well, you could spot a big problem, because remember, I lived through art glass, where they come out with this new crown where this art glass was on the metal and it delaminated. Ivoclar came out with Targus Vectrus. It delaminated. I mean, we've had some product issues, obviously, in the past, like every industry. But in dentistry, it just took years and years and years. So then you hear on the grapevine, you hear like, well, Jim Glidewell is going to sue Hooray scolds her for art glass because he's having all this delamination problems. And then you're sitting there like, dude, I'm still doing those. And then your friend's like, oh, I heard that, I heard this, and it's like, it shouldn't come down to what you heard on the grapevine or what your buddy that you watch football with heard. It should be a big data-driven thing. I mean, hell, there's 150,000 dentists. They're all using this product. And what if there was 2 bonding agents, and one bonding agent, if you use it on a molar, in 5 years, 1/3 of the teeth needed a root canal, and the other bonding agent, it was only 10%. I mean, there's just so much low-hanging fruit that if dentists got better organized, and if the insurance companies and the manufacturers and the dentists, if everybody shared their information better and were on the same page, the patient is going to win. And I always tell people, I don't care what a dentist thinks about the manufacturer, the insurance company, the government, this and that and that. We're supposed to have one eye on the patient and one eye on cost. And if we keep one eye on the patient and one eye on cost and use our brain to drive up the quality and drive down the cost, then more humans will have the freedom to afford to keep their teeth, which I think is a basic form of dignity. And I just think dentists should all work together so that more humans, there's 8 billion humans, and if we reduce those 8 billion to 3, one of them has a smartphone like you and I do, but one of them only has a cell phone with no internet connection, and 1 out of 3 doesn't have anything. He doesn't have a phone or a smartphone. And so that's keeping it real. That's like when people badmouth amalgam, I'm like, well, that's a rich world problem that you don't want this amalgam to show up in a selfie. I mean, there's 1 out of 3 humans doesn't even have a smartphone to take a selfie to post as black filling on Facebook. And I just wish they would all work together to make dentistry better, faster, easier, higher quality, and lower cost so that more people will have the freedom to afford to keep their teeth. And I think you're an epitome of that next generation dentist, entrepreneur, innovator. And I just congratulate you for all that you've done. Hell, I just congratulate you for getting accepted to Harvard. But good luck on your journey, because there's 8 billion people that are counting on you to make dentistry better, faster, and cheaper.
Thank you so much, Dr. Farr, and I'm very humbled by whatever you described. I mean, that's a really fact, and thank you so much.
Well, thank you for coming on the show, and I hope you find the next big thing in dentistry even faster.
Yeah, hope so.
All right, well, have a great day.
Thanks, you too.